Giardia is a common protozoal parasite of dogs and cats, most commonly dogs or young puppies. Giardia is often picked up from the environment, from other dogs in daycare or breeding situations, or from contaminated feces or contaminated water in sometimes the backyard of suburban areas, or going on hikes, dogs out at the farm as well too. So it's a very common issue to deal with Giardia. Giardia will often cause soft stools, diarrhea, and or vomiting. We will test for Giardia if we have suspicion. The test is usually a stool sample that we can run here at the clinic and get a quick result for. If your dog tests positive for Giardia, it needs to undergo treatment. Treatment is usually going to be a course of 1 or 2 different medications that we can go over the dosing of that with you. We will want to recheck a stool sample to make sure that your pet is clear of Giardia before we discontinue treatment. Besides the treatment that we'll send home with you, it's very important that you also do a few things at home to minimize the chance of reinfection or contamination. So since Giardia is shed in the stool, it's very important that we pick up after them. So picking up their stools right away, keeping the yard clean, and if it's softer diarrhea in the yard, then using the hose to spray it down and dilute that area of the yard as much as possible. If they have accidents inside, then using, if possible, a dilute bleach solution will kill Giardia. So if your carpet or upholstery will take it, then dilute bleach is best. Otherwise, scrub vigorously and try to dilute or minimize contamination as much as possible. It's also going to be very important that you change the water frequently in their water bowl 3 or 4 times a day and rinse out as well too. That can minimize contamination from that source. Also, after they go to the bathroom outside and have a bowel movement, it's important to either wipe their rear end or give their rear end a rinse or a wash to minimize contamination back there, especially among young puppies who will often kind of lick and chew back there. That can be a source of continued contamination and a reason we might have to do multiple rounds of treatment of Giardia. It's important that you continue medications until they are finished to ensure that we completely get rid of Giardia, but with the risk of contamination or recontamination, it's important that we recheck a stool sample, usually about 4 to 7 days after they've finished treatment, to make sure all life stages of Giardia has been cleared. At that point, we will consider them cured, but if they relapse or the test is positive, it's not unusual that sometimes we will have to go through multiple rounds of treatment. Usually after we have done a test to ensure that we have cleared the infection, it's going to be important that you monitor for any relapse of the disease, especially if they become recontaminated. But as they grow older, they are less likely going to have clinical giardiasis or Giardia infection.